Hello, listeners. Welcome to Views on Health. And as it another Monday evening comes by, back with us in the program is Dr. Dakshitha Wickramasinghe, consultant surgeon, National Hospital of Sri Lanka, and senior lecturer in surgery, Faculty of Medicine, University of Colombo. We had Dr. Dakshitha Wickramasinghe last week too on the program with the topic preparing for surgery. Tonight, it's the other side of it, the other side of the coin, so to speak, care after surgery. Another important aspect because uh, patients who undergo surgery do need to take care, depending, of course, on the type of surgery they've undergone and what they should do to protect themselves not to have any issues thereafter. Having said that, whilst welcoming you back to our studio, Doctor, may I ask you to discuss, for the benefit of our listeners, care after surgery?
The care after surgery will depend obviously on the surgery you had, as well as the anesthesia and a number of other things. But I'm going to talk about today is general advice for anybody undergoing surgery. But if there is any specific advice that you require, your surgeon who performed the surgery would have already told you. The first thing that anybody coming out of surgery will have is a dressing over a plaster over where the surgery was surgery was performed. This dressing, as far as a surgery is concerned, is there to cover the wound, or what we call the incision, which was used for the surgery. It is covering the wound because it takes approximately 3 days for the top layer of your skin to heal. There will obviously be deeper layers which heal at different rates, but for as far as the dressing is concerned, it is there to cover your skin for the first 3 days till the top layer heals. And we use different types of dressings, and there are different time periods that you need to leave these dressings on to protect your wound. If we don't expect any problems with the wound and we think you can keep it safe, we would advise you to keep that dressing for about a week, give or take, until we advise you to come back. Sometimes we might expect a problem with the wound. Maybe we expect some infection in the wound. So we might advise that you need to remove the dressing in 3 days and inspect or have a look at the wound. Sometimes we put multiple dressings or multiple layers of dressing. The layer that is in contact with the skin can be left for a week perhaps, but the one on top is there to put some pressure on that area so that you won't get any bleeding. So you may have two dressings over the same wound. So how long you need to keep them would depend on the purpose of this wound. Why this is a common problem is what do you do with this wound that you cannot do otherwise, and it's generally about hygiene. Can you have a wash? And generally we talk about showers to wash yourself, not a bath, because it's very difficult to keep or protect a wound when you're having a bath. Uh, as far as we are concerned, we are not worried, or we don't want to prevent you from having a shower. It is not a surgical concern for us as long as the wound doesn't get wet. I told you it takes 3 days for the top layer to heal, so we don't want the wound to get moist before that because that moisture can cause maceration of the skin and certain changes and may even lead to infection. So it is very important that you maintain the wound in that dry state for that initial period. Now we use waterproof plasters wherever possible so that this problem with having a wash or a shower is no longer there. If you use this plaster, we'll specifically tell you that the plaster you're having is waterproof. So there is no problem of you having a bath or a shower. There is no problem of you having a shower because that plaster will prevent moisture from reaching the wound, and you can shower as usual. The other options for having a shower is it's very easy. If your wound, for example, is in your hand, you can cover it with a towel, put a polythene bag on top, and you can have a shower, and it will prevent the wound from getting wet. Same for your foot. If you have a wound or a plaster over your foot, put it in a plastic bag and have a small footstool and elevate it so that water will not reach it. So the primary concern is that you keep the wound covered without excessive moisture reaching it, but also to prevent any other germs from the environment to reach it. That is why you have that plaster or the dressing, and that is how you take care of that plaster.
Thank you, doctor. So the first thing is the concern is about the dressing and the fact that the patient might want to, have a shower, and but if the patient doesn't want to have a shower, is that all right?
So this is obviously beyond surgery. It is important that you maintain proper bodily hygiene, and it is especially in a warm country like Sri Lanka. I cannot recommend going without washing or cleaning yourself for too long. This has nothing to do with surgery, but it is important that you maintain an appropriate level of hygiene and wash or shower appropriately. So I cannot know. So even if you don't want to, we would recommend that you follow what a normal person would and shower or clean yourself.
Thank you. So, doctor, in this state, depending on the surgery, of course, there may be certain surgeries where a shower may not be advisable immediately.
Yes.
When you say shower, you mean the next day?
So it depends. Now, our concern is hygiene, and for most surgery you undergo under local anesthesia or spinal anesthesia, you're mobile. So even if you undergo surgery for, say, a hernia, you'll be walking around the next day. So there you can have a shower as usual. If you've undergone major surgery and you're back in the ward, and say you have a large wound on your abdomen, you may not be able to get up and go to the shower. In which case, hospitals or healthcare systems have different ways of cleaning you. You may have a sponge bath while you're still in bed. But it is important that you keep your hygiene.
So the key here is hygiene.
Yes.
Thank you, doctor, because that's so important that we, share that with our listeners, because if that is a must, that you obviously want to be clean, nobody wants to be dirty, and therefore you have to sort of adhere to medical advice and do what it takes to be hygienic when you're on bed still.
Yes.
Thank you. So the next area of caring after surgery, is it anything to do with medication, diet?
So I would say
physical activity.
I'd say the next thing goes along the same lines as the dressing or the plastic is sutures or stitches. So it's very unlikely that you would have surgery without any stitches. They may not be visible, but you still have stitches, especially even on the skin. So people are worried about stitches. They think stitches are necessarily a bad thing. And this, I suppose, comes from the bad reputation surgeons and skin suit stitchers have got over time. And especially, I suppose, movies tend to dramatize things and exaggerate scars following surgery. But modern surgery and modern techniques will minimize the scars. Often, the scar will be less with sutures or stitches than if you have no stitches. Sometimes people refuse to have stitches saying it will scar. But no, stitches will actually reduce the scar you will get. So when we talk about stitches, there are two broad types. One are dissolvable stitches. If we put them for your skin, you don't need to come back for the stitches to be removed. The others are non-dissolvable stitches which need to be removed at an appropriate time. The time takes depends mainly at the rate of healing. Different parts of your body heals at different speeds. Some place like your face, which has a good blood supply, heals very fast. So we can remove stitches faster, in a few days. We like to do that because that leaves that reduces the chance of scarring. A place like your hands or your leg, where it moves and stretches every day when you walk, would take longer to heal and we keep the stitches for longer. So the time taken to remove these stitches that don't dissolve will depend mainly on the site that they use. We also have other techniques to close the skin. Uh, we sometimes use glue and stick the skin together. And again, there is nothing to remove. The glue will just fall off once the skin starts healing. And sometimes we use stickers called steri strips, again to keep the skin together until it heals. We mainly use this in children because it doesn't need anesthesia and it's a painless procedure. It's not suitable for every situation, but it's an option. When you're having stitches, because that's by and large still the commonest way that your skin cut would be closed after surgery, you need to know how to take care of it. And the dressing there is to keep the wound covered from and to prevent germs from coming, but also to keep the stitches covered because stitches will have small ends of thread which may get tangled with other fabric, may get pulled, that may be painful, stitches may come undone. So you need to make sure that dressing that was there to cover it remains covering the stitches until the doctor tells you to remove it or the doctor advises you to come back to remove the stitches. That I suppose is the next common doubt or the worry people have. Then it is about eating after surgery. Uh, if the surgery you had has any specific conditions or requirements, the surgeon will tell you. And the advice I'm giving is for general following any surgery uh, without an involvement of your bowel. Uh, if you've had surgery of your bowel, if you had surgery under general anesthesia, it will take a longer time for things to come back to normal. So we build up your food intake and body intake gradually. We can't all of a sudden start you back on a normal diet. But for any other surgery, you can eat and drink after you have recovered from the anesthetic. And mainly that's general anesthesia or spinal anesthesia. If the surgery was under local anesthesia, there is no restriction. You can eat normally immediately after surgery. Often, you need to go slow. You cannot get back to your normal diet immediately after surgery uh, because the drugs we use for anesthesia or the surgery itself may give rise to vomiting, or even if it doesn't cause vomiting, you may feel sick or nauseated. So you cannot eat a lot. So you need to take it slow, small, frequent portions, and build up. Generally, after any surgery, excluding the major ones I've spoken about, by the next day you're back to having your normal meals. The other thing is sometimes people, especially after cancer or problems in their bowel, they may not have been able to eat normally before their surgery. So they may be weak, their stores or reserves may be low, so they actually need to build up after their surgery. So you may need more nutrition after your surgery to catch up to what you lost or couldn't gain before surgery. And another thing I need to emphasize is that as far as Western medicine is concerned, there are no food or drinks or fruits that make your body excessively warm or excessively cold. So we do not advise you on avoiding anything. We hardly advise on avoiding any specific food unless you found yourself allergic or the food worsening your symptoms.
Thank you. That's very important because we do have this sort of, I would call it a myth in Sri Lankan culture that you eat certain foods, it brings your levels of body pressure down or something goes up or on those lines. And certainly, as you said, doctor, if there is an allergy, one has to avoid that. but otherwise there's no need actually to avoid any type of food
No. So
because end of the day, it's food is meant to nourish you.
yes. So two small caveats to that statement. One is everything in moderation. No, you shouldn't overdo things. The second would be for patients with diabetes and avoiding sugar in any food containing excessive amounts of sugar or starch, which can be converted to sugar. But outside those recommendations, we don't advise anybody to avoid anything.
But also, if there is hypertension, you have to avoid the salt. Salt intake is
So
to come down, or
it depends on your level of hypertension, what actually is causing your hypertension. It is not, I mean, avoiding salt in general is a good thing because anyway, our food will have a certain amount of salt. Adding salt at the table should definitely be avoided. And in most situations, it is we. I mean, there is a tendency when preparing curry to add a lot of salt. So we always have healthy or sometimes even more salt content in our food. So avoiding salt depends on whether your blood pressure is going up without even despite having treatment. If your blood pressure medicine are working and your pressure is under control, you don't need to avoid salt because salt or table salt has sodium and chloride, both of which are major constituents in your body. So your body needs sodium and chloride. It is it is an excessive amount of salt that is unhealthy.
taking the word moderation into focus. Whilst the meal should be moderate, I mean the quantity is
Yes.
moderate. Uh, but how would you recommend, or not recommend? How would you comment on fats,
Okay, so
the oils?
fats and oils are an essential component of your diet. It is unhealthy for the majority of the population to stick to a low fat or low fat, extreme low fat diet. What you need to understand is what your body needs. So that can easily be calculated. I won't go into detail, but how you know what to eat is first you need to calculate the amount of energy you need, and then you divide it between carbohydrate, protein, and fat. So depending on how this is distributed, at least 20 to 30% should, maybe 20% should come from fat. Uh, it is again to do with moderation. The problem in our diets, which we often see, is it is not very balanced. There is a very large portion of starch, either rice, string hoppers, bread, and very little vegetables, meat, or anything else. So that is the biggest problem, this imbalance of the diet. If you're consuming an in appropriate portions, what you're supposed to consume, it obviously becomes in moderation.
Thank you, doctor. Doctor, we talk about care after surgery. Medication, obviously, there is medication in most cases, unless it's like you said, maybe a lump in the hand or something that is
Yes.
removed, through locus anesthesia, and maybe some sort of a painkiller, but no medication per se.
Yes.
Uh, as far as medication is concerned, of course, again, it will vary from patient to patient and ailment to ailment. But there are sort of situations where they have to take certain medications in the long term.
Yes.
And then, but when the patient feels well, they stop.
Yes. So it's very important that you follow the advice given to you by the doctor or the surgeon that dealt with your problem. For example, if you take diabetes, there's nothing to do with surgery. Most people with diabetes have no symptoms. And they think because they're not having symptoms, they are either cured of diabetes or it is under control and they stop their treatment. Same goes for cancer. Sometimes, especially cancer like breast cancer, we might start a person on tablets, which may go on for a minimum of 5 years, sometimes 10 years. And these have been shown to keep or control the cancer and to prevent it from coming back within that 10 years. Once a cancer is removed, the symptoms of that cancer will not come back. But there can be tiny cancer cells in your body that can get reactivated. These medicine, which we give for 5 or 10 years, will stop the cancer from growing. If you stop them, the only time you will realize that there's a problem is that when those cancer cells grow and spread either to a lymph node or to your liver or to another part of your body and gives rise to another lung. So it is very important that you don't stop medicine by yourself without consulting a doctor. Same goes for everything else. Sometimes we might start somebody on a treatment for a short duration. For example, if you've had surgery in your hip, we would want to prevent a clot in the blood vessels of your leg. So we will start you on a special blood thinner, maybe for 2 weeks, maybe for a month, and we'll stop it. And that's fine. That is part of the plan. But anything that you've been advised to take long term, simple things like thyroxine after your thyroid gland has been removed, need to be continued until the doctor tells you to stop it.
And Doctor, what for infections after surgery? There are cases, instances when the patient had some sort of infection.
Yes. So infections after surgery, mainly we're talking about infections in the incision that you've had or the cut you've had for your surgery. So that is called a surgical site infection. So the risk of that infection depends on the type of surgery you've had. If you've had what we call a clean surgery, for example, a thyroid surgery, the chance of infection there is very little. It is less than 0.5%. In contrast, if you've had surgery, what we classically call a dirty surgery, say you've had an abscess that required draining, if you had surgery of your large bowel, the chance of infection is much higher. So, first thing you need to understand is the risk of infection depends on the type of surgery or the actual surgery you're having. There is very little that you can do or you will do that will affect that risk. General things like keeping the dressing, taking antibiotics if you've been prescribed antibiotics, are important in minimizing the risk of infection. But otherwise, the chance of the infection depends on a number of things beyond the control of the patient.
Doctor, you spoke about the infections. Now, sometimes will there be something within the system, an infection? Is it possible after surgery?
Yes, definitely. So this happens mainly when you undergo major surgery. For example, inside your bowel, inside your abdomen. If you've done surgery of your bowel, there's always a risk that when we join two ends of bowel, that there might be a leak. So that if it leaks, that will give rise to an infection. If you have bleeding and collection of blood inside your tummy, there can be an infection there. So there is always a risk of infection, which brings me to the next thing that I wanted to talk about care after surgery, is when do you come back to your doctor with a problem. So it is about identifying problems. Generally, we will always schedule a follow-up visit after surgery just to check how things are. And it's obviously, if you need the stitches to be removed, you will need to come back. But sometimes you can't wait for that long. When do you identify, or how do you identify that there is a problem coming? If you're getting fever is a very good indicator that something is not right. If you're having an undue amount of pain, if you were well after surgery and the pain was gradually reducing, but all of a sudden the pain has worsened now. If you see redness around the area where the surgery was done, if you notice there is any pus coming out from the wound, or if you feel unwell, if you're vomiting, or if you just not feel right, that is a time to either come and see your doctor, or if it's inconvenient or not possible to go and meet the surgeon that did the surgery, at least to go to the nearest doctor. All of those things may indicate a complication. It may be something else, but it is always better to be safe than sorry.
So you obviously deal with it according to the situation.
Yes.
You cannot generalize that.
No. So all of these things will depend on the specific surgery you've undergone. If there is any specific advice, the surgeon would give you.
Thank you, Dr. Time has caught up with us. What would be your take-home message?
So surgery for anybody is a very stressful condition, both physically and mentally. Your recovery after surgery will depend on you following the instructions that were given to you about taking care of your wound, the plasters that were put on, the stitches, eating and drinking, uh, walking and getting back to your normal activities, and identifying problems that are developing. It's very important that you understand the instructions that were given to you and you're alert to the things that were told, because if you follow the instructions, you will be getting back to your normal activities the fastest possible time.
Thank you, Doctor. With that, we end this interesting discussion on care after surgery. And we wish to thank you very sincerely, Dr. Dakshitha Wickramasinghe, Consultant Surgeon, National Hospital of Sri Lanka, and Senior Lecturer in Surgery, Faculty of Medicine, University of Colombo, for being with us on the program and once again sharing your expert knowledge, this time on care after surgery. Thank you once again, Doctor.
Thank you very much.
Thank you to Manjula Seniratne for technical assistance. I'm Fatima Razi Kader. Saying good night and looking forward to your company next Monday, same time on Views on Health.